everybody. Did you hear about the Flurona that's going around? Israel reports its first case of Flurona. Birthing mother diagnosed with both coronavirus and influenza virus infection simultaneously. Health officials estimate many other patients also came down with both pathogens but have not been diagnosed. This is December 30th, 2021. The double infection was first identified in a woman who went into labor this week at Rabin Medical Center in Petah Tikva, according to the hospital. The young mother, who was not vaccinated against either pathogen, is feeling well and is expected to be discharged from the hospital later Thursday. The health ministry, get out your video. Get here! The health ministry is still examining the case, which was relatively mild and is yet to determine whether a combination of the two viruses causes more severe illness. Health officials estimate many other patients have also come down with both bugs, but not have been diagnosed. Last year, we did not witness flu cases among pregnant or birthing women, said Professor Aaron Vishnitzer, an obstetrics and gynecology specialist at the director of the hospital's gynecology department. Today, we are seeing both coronavirus and the flu that are starting to rear their head. We are seeing more and more pregnant women with the flu. It is definitely a great challenge dealing with a woman who comes in with a fever at childbirth. And do you know if it's coronavirus or the flu? So you refer to them the same. Most of the illness is respiratory. Because you know what? They are the same. She was diagnosed with the flu and coronavirus as soon as she arrived. Both tests came back positive, even after we checked again, he said. The disease is the same disease. They're viral and cause difficulty breathing since both attack the upper respiratory tract. Meanwhile, Israel may be facing an incoming influenza epidemic as hospitals reported treating 1,849 patients with complications of the disease over the past week, according to the data published Wednesday by the Health Ministry's Center for Disease Control. Among the hospitalized are 605 children and 124 pregnant and birthing women. Most patients have contracted the influenza A virus subtype A/A/H3, which is included in the flu shot given in Israel this winter. The influenza virus can give rise to a whole host of severe symptoms, including pneumonia, among other respiratory complications, myocarditis, heart muscle inflammation, and death. Oh, okay. Yeah. Love all those heart attacks from the flu. All the previous years before. The health ministry has called on the general public from the age of 6 months and up to get vaccinated against the flu. The flu vaccine can be given together with the coronavirus vaccine or at any time interval from it. Oh my goodness, people. The Flurona is coming! Oh. But that's okay. Because, you know what? They've been priming us for this for a while. Twindemic, baby. It's here. It's coming. Potential twindemic emerges. Flu cases surge along with COVID-19 cases. November 1929. Twindemic emerges with experts predicting more cases of the flu this season. The National Global News, October 24th. Twindemic fears are back, and this time they might foretell a tragic season. CNN, December 7th, 2021, and so on and so forth. Then I read this funny little story. I read part of it because I didn't want to waste my time reading it because it's garbage, but it was funny. The double whammy COVID flu. It's becoming clear that co-infections happen all the time. Just how bad are they? By Roxanne Kamsey. November 17th, 2021. In late February 2020, only a couple of weeks after the pandemic coronavirus disease had even received a formal name, a man with a terrible cough and fever showed up at the Pro Health Urgent Care Centers in Queens, New York, At that point, no COVID-19 cases had yet been confirmed in New York City, but numbers were on the rise in spots across the country, and the man had recently been at a conference. An ER-trained physician donned protective goggles, a face mask, masks, and gloves, and went in to swab the man's nose with a giant Q-tip. Look at that giant Q for the giant Q-tip, everyone. That's a big Q-tip. With any luck at all, this would show he's gotten sick from some other, more mundane pathogen, and that the timing of his symptoms was just a grim coincidence. Within a few minutes, the staffers got just the answer they were hoping for. The swab was positive for influenza. But Daniel Griffin, a researcher of Columbia University and the chief of the infectious disease division at ProHealth, wasn't ready to let his guard down. Wait a second, he says, he told the healthcare team, as colleagues prepared to shed their protective gear. Yeah, that sounds really responsible. How do we know this gentleman isn't infected with the pandemic virus? He suggested that they all assume the worst until they had a chance to run some further tests. In early March, those results finally came in. Yes, the man was positive for the pandemic virus. His wife was too. And so were their kids. The whole family had COVID-19 and the flu. I think those other staffers were going to shed their goggles because it's the flu, everyone. There's no need to fear. Oh, it's just the flu. We can act normal. Yet, here we go with the Flurona, the two most deadliest viruses in the world. Here's Fauci here. Yes, you can have COVID-19 and the flu at the same time. Here's what it could do to your body. Oh my goodness, I'm terrified, people. Oh, I have to take a breather here. As doctors worry about a coronavirus and flu twindemic that could overwhelm the healthcare system, Americans must contend with another possibility: fighting both viruses at the same time. Oh. You can certainly get both the flu and the COVID-19 at the same time, which could be catastrophic to your immune system, said Dr. Adrian Burrows, a family medicine physician in Florida. It's so deadly that when it hits a pregnant woman who's unvaccinated, nothing happens, and she's fine afterwards. Terrifying! Oh, but that's not all, folks. We have to worry about the possibility that the viruses may merge with each other and make, what did they say? It could make the Frankenvirus. Nope, that's highlight there. Frankenvirus. Look, it's possible. They said it. They said it's true. SARS-CoV-2, the virus that causes COVID-19, almost certainly originated from a hybridization of two different coronaviruses. The details remain hazy, but the virus's genome sequence suggests that the mashup occurred in a bat about a decade ago. The bat was simultaneously infected with two closely related coronaviruses, which merged together. That's all I'm allowed to read because they said I have to pay to read more. I'm not going to know now. But that's okay, people. There's help on the way. Concomitant COVID-19 and influenza vaccination tested against pandemic, October 13, 2021. The first clinical trial to assess concomitant administration of any vaccine with either an adenoviral vector or mRNA COVID-19 vaccine found the combination with influenza vaccine is safe. Produces immunogenicity. Oh, now I clicked it. Immunogenicity associated with separate vaccination and supports the combination as an efficient intervention against the possible twindemic. Now, don't be afraid, anyone. That was my furnace going off. It wasn't Flurona. Validation of a more efficient means to vaccinate against these viral infections is particularly welcome as flu season has commenced in the U.S. and Northern Hemisphere countries. And a recent survey from the National Foundation for Infectious Diseases, NIFID, shows that 44% of the U.S. population are unsure or do not plan to get vaccinated against influenza. What? They don't plan it? Those anti-vaxxer scum! Rebecca Lazarus, D. Phil, Department of Microbiology, University Hospital, Bristol and Weston, NHS Foundation Trust, Bristol, UK, and colleagues of the Conflucove. Oh my goodness. The Conflucove trial group anticipate that concomitant administration would reduce burden of healthcare systems and report concomitant vaccination raises no safety concerns and preserves the immune response to both vaccines. The investigators recruited 9 participants who had received the first dose of either the adenoviral vector SARS-CoV-2 vaccine, ChAdOx1, AstraZeneca, or the mRNA vaccine BNT162b2, Pfizer-BioNTech, and randomized 1-for-1 to receive either placebo or an age-appropriate dosed influenza vaccine, adjuvanted, trivalent, or cellular recombinant quadrivalent, with their second COVID-19 vaccine dose. Follow-up monitoring was available for 665 participants, whatever. Why couldn't they do 666? That's the lucky number. They were one off. The study monitored for adverse effects and assessed laboratory indicators of immunogenicity from April 1st through to June 26th of 2021, outside of influenza season. The study was interrupted April 8th when notice was received of a thromboembolic events associated with ChAdOx1 and resumed April 9th with exclusion of participants with risk factors for thrombotic events. The primary outcome was one of more solicited reports of systemic reaction with 7 days after vaccination, such as fevers, chills, or joint pains. Secondary outcomes involving safety and adverse response included solicited local reactions such as pain or tenderness, and unsolicited adverse events, including medically attended adverse events. The secondary outcome of immune response was determined from the measures including SARS-CoV-2 S protein, immunoglobulin G, anti-S IgG concentration in serum collected on day of vaccination, and day 21, and hemagglutinin antibody inhibition against the 4 strains of influenza contained in the 2020-21 formulations, or DO, day 21 and day 42. Other immunological measures that will be a subsequent report include neutralizing antibodies against SARS-CoV-2 and DO in day 21, and mucosal immune responses to COVID-19 vaccines in saliva. Lazarus and colleagues reported that overall, 555 out of 665, 83.5%, of participants had at least one solicited local adverse reaction after vaccination on DO, and 85.2% of those receiving concomitant vaccinations and 81.7% with placebo in lieu of influenza. The numbers with local reactions 7 days after injection were similar in both groups, although higher among those receiving the active combination at day 21. Rates of medically assisted adverse events were similar between groups following both DO and day 21. I think we understand now. This is boring. By performing the trial in relation to the second rather than the first dose of COVID-19 vaccine, we have evaluated safety and immunogenicity in primed individuals, Lazarus and colleagues point out. Therefore, the findings are also likely to be more relevant to the question of concomitant administration of booster doses and seasonal influenza vaccines, which over time, they may become the norm in many parts of the world. I'm doing the Biden voice now. You gotta whisper. I think I'm done reading. Thank you so much for your time and attention. This is Venomous, reporting from the brave new Flurona World Order. Thanks for stopping by. Links in the description.
Are you talking to me? No way, punk!